Hello, thank you so much for listening in. I'm Samantha Yancey,
And I'm Alan Yancey.
and this is Ask a Massage Couple. In today's episode, we'll be talking about cancer and massage.
And I'll be talking about empathy overload.
So sit back, listen in, and let's get our session on.
Let's get it on. I'm going to tell you that.
Well, no, of course not.
I think we've covered that.
No judgment of what your local hawks decide to wear.
Or I'm going to say not only that, I'm going to talk for every bird.
For every bird.
Yeah, because,
Could we not extend that to like every animal? Like, really don't care what a bear wears.
I don't know if I'm really comfortable for that yet.
What about a fox? Does that bother you? Because, I've had some issues with raccoons in the past, but...
Oh, yeah, raccoons.
But now I'm okay with the raccoon. I have stared into the eyes of my fears, and I'm okay with raccoons now.
Well, Sam, I'm glad that you've have gotten over this raccoon fear because, that kept you from being the person you wanted to be.
Look,
a raccoon farmer.
No, I will probably never go camping like that again. I was camping with my family.
And what age is this?
You know what? Sadly enough, I think I just graduated high school.
I was hoping it would be 13 or 14, but no, the story just got sad.
Hey, so I had to wake up in the middle of the night and go to the restroom, which that by itself, no fun, right? And we were staying at a place called Amicalola Falls, and it has like little campgrounds where you can stay, but then there's like an actual like restroom where you can go use the restroom, take a shower, blah blah blah. And I got up in the middle of the night and went to the restroom, and while I was in the restroom, a raccoon cornered me in the restroom and would not let me leave. He stood up on his hind legs, Alan Yancey, and had his fingers out all spread like this, and was hissing at me like...
Yeah, I think that's over dramatic, Sam. But hey, thank you for that actual reenactment.
It scared the crap out of me.
Well, I'm sorry that you had to live through that incident, Sam. But I think you could have probably still gotten past it.
The messed up
but
thing is
sometimes
that
raccoons have rabies too. You gotta watch out for that.
That's what I'm saying. The funny thing is like I didn't even notice them by the trash cans on my way into the restroom. I just had to go.
Yeah. Right.
But they obviously saw me.
Oh yeah, and then they say, "Hey, we've got some."
I was like, "Hey, we have somebody over here."
Did you get on top of the toilet? How did you escape this thing, Sam?
Well, I mean, finally he got down on all fours and like wandered back to the trash can.
Why did you say "Get away from me, raccoon"? Or...
No, I probably did some kind of like but I don't know.
I mean, you didn't try to make it like skadoodle, like get out of here.
I was freaked out.
Okay.
Yeah, he was standing in the doorway of the where you can get out.
I think if you're ever cornered by a raccoon, I think it's well known you're supposed to look them straight in the eyes and scream skadoodle.
Skadoodle. Skadoodle, raccoon.
Yeah, I've read that in my camping journal.
Yeah. Now, is that right next to bang some sticks together to scare away mountain lions?
Yeah, well, as long as you don't scare bears, because that, they have feelings.
Yeah, they do. And you know what? We don't judge bears if they dress in drag.
Okay, well, okay.
I'm just saying.
Okay, I don't have a problem with it.
So, I wanted to kind of bring up something. I was listening to a past episode, and I realized that I said something.
Oh my goodness.
Yeah. Now, when I was talking about it, like, I think I was like just kind of talking and then did not like really specify what I was saying.
If we're going back and redoing all the shows, I don't know if I can afford it.
No.
Oh,
It's just it was just this one thing that I caught, and I was like, oh, let me clarify that.
um, Sam, did you have a lot of hateful letters over that mistake?
Oh no, this was just me like, oh, that sounds like whatever.
Well, I want you doing like I do. I just keep plowing through.
No, I know you do, and I love that about you.
But if you're going back and actually listening to yourself and seeing if it's correct,
I like to be correct.
I
That's
know
all.
you do.
That's all.
People tune into this show for facts. We're a fact-driven podcast, Sam.
Yeah, it has nothing to do with this awesome sauce right here.
No, the fact is, Sam, is that most people tune in because they're on your Facebook page, Facebook friends.
Yeah, they're my Facebook friends.
They're not mine.
I'm sorry, Alan. Although we have had quite a few followers on Twitter recently.
Really?
People that I don't know.
Well, if they ask you for money, to say no.
It's not that kind of thing.
All right.
Like they've actually liked our stuff
Oh,
when I put it on Twitter.
wow.
And I don't know these people.
Well, there's a lot of people out there. There's like any damn thing,
Yeah, maybe. Maybe.
Yeah.
But you know what? For those of you who are listening in, feel free to just go ahead and, if you are entertained, even in the slightest by us, or you learn something, please share our information with your friends. Especially if you're a massage therapist, share them with other massage therapists. Because, you guys are what we are doing this for.
Yeah, you can share it with people that are massage therapists, people who have gotten massage, people who need massage, people who've ever thought of the word massage actually would be good for this podcast.
Yeah. I mean, I kind of wanted to start this just because I had so many students sending me questions after they had graduated. And I wanted to kind of create something that allowed me to answer them, but then answer the question to everybody at the same time. So, yeah. There's something about the personal interaction that is really nice, knowing that they can get me on email at any time.
Right.
And honestly, I like that too.
Well, I know you do. I keep up with my email very vigorously. Make sure all my emails answered in a timely fashion.
That is so false. That is so false. It's ridiculous. I want to know how many unread emails you have right now.
Listen.
I'll pull that up. Guys, it's ridiculous.
Here we go. I've got 778 unread email, and that's not including my junk.
Seriously, if I allowed my email to stack up like that, I would be fired and not realize it.
Oh, let's see here. Yeah, well, I have yet to find anything worth looking at or even tapping on to respond to. Sam, I use my email to get into the different apps and different websites.
Yeah.
That's about it.
Okay.
I mean, nobody contacts me. I mean, the email is kind of like the Pony Express now. That's out of date.
Why don't you just have like a Yahoo or something email address that you send stuff like that to, but then real stuff comes to your actual one?
I don't have real stuff, Sam.
Oh, yeah, that's right. Because if you do have real stuff, it gets sent to me so that I can organize it.
Exactly. You're forwarded because you look at your email.
It's true. Let's see how many emails I have right now.
This is exciting.
Is it?
No, really.
I have no unopened emails.
Well, let me send you some about email. People are sending me things that I don't need.
I have no idea what in the world you're talking about.
I'm going to show you. I'm going to just tell you. This is some of the stuff.
This is like the longest intro about nothing.
Well, I didn't even know we're introing.
Yeah.
Well, I'm getting Zillow to tell me. Sophia says check out my private sample photos.
Alan, why don't you unsubscribe to those?
Well, have you seen the photos?
No. Are they good?
Not really.
Well, then unsubscribe, fucker.
I don't have time for that.
Let me just clarify on the headache episode, because I did not touch on the fact that dehydration is a big contributing factor to headaches.
Sam That's one thing I love about you. You listen to it and you go back and say, how can I make this better?
Yeah.
That's one thing I like about you.
I think it's just because I'm a teacher.
Yeah, and I listen to it and I say, I don't want to listen to that again.
It's true.
Yeah, and then you go back and you every show you go back and say, darn it, I should have said that.
Yeah. Yeah, I do.
Yeah, I don't.
I know. And that's what I love about you. You are definitely like the past is the past, whatever, la la la. And I'm looking at this more of like I'm still in a teaching role.
Yeah.
And I like to be very clear and clarify things.
Yeah, me too.
No, you don't.
I'm all about clarity. So.
No.
What are our topics today, by the way?
Well, I'm actually talking about cancer and massage.
Wow.
I've had quite a lot of questions about that recently.
Yeah.
And it's kind of interesting because I've recently started teaching Intro to Oncology at the school.
Okay.
Basically, for the folks who have not sat in the Intro to Oncology class that we've done, I'm basically just going to like skim over things briefly.
Yeah, because this is a very in-depth subject.
It really is. It really is. And I highly recommend, if you are interested in working with oncology patients, that you absolutely go to a class and learn more, because I can't teach you everything in a podcast.
If I recommended somebody start out in massage right now, this would be definitely somewhere I would recommend somebody to go to classes.
Yeah, absolutely. I mean, unfortunately, cancer isn't going anywhere. At least right now. There's actually been quite a lot of research done that's kind of interesting. It's still not getting to all cancers, it's just getting to a few of them. So it's not going anywhere right now, and the public opinion about massage and cancer has drastically changed now that we know a little bit more. So you're going to have more cancer patients that want and need massage, and you know what? You can actually work on them. Yeah. And that's like one of the main things that I wanted to talk about with this, is that for the longest time, like in massage, it was thought that if somebody has cancer, you should not massage them, because you can actually metastasize the cancer, or like spread it throughout the body.
Yeah, you think about, with the lymph nodes and things like that.
Exactly. But in all actuality, that's just not true. The only way that you can really spread someone's cancer is if you are working directly on a tumor site, or moving tissues up onto a tumor site, and it makes the tumor like shed some cells, and then it gets into the circulatory system and moves around. So obviously, if you know that there's a tumor there or a suspected tumor there, don't work that area at all. And like, there's no real issues with massage.
When I first started this business, cancer was just, you had cancer when it's not going to see you.
Yeah, absolutely. I've had to tell quite a few people, I'm sorry I can't work with you.
Yeah.
Or I'm sorry, the only thing that I can do is like, foot massage or hand massage.
Yeah, things are progressing rapidly in the in oncology.
Absolutely.
Massage.
I mean, we just know so much more now than we did like
just 15 years ago.
Yeah, seriously. One of the other things that tends to come up with this subject is cancer patients. You really shouldn't do massage on them, because it would be a little bit too stimulating to their body. Like they're weak, and that might be too much. But I mean, massage, number one, doesn't have to be stimulating. Depending on the amount of pressure that you use, like, you can actually be quite soothing and comforting. And that really is the change in mindset that you have to have with oncology and massage, is that it's not about seek and destroy.
No.
The way like a lot of like deep tissue massage therapists or neuromuscular therapists like tend to think of the body as like, I gotta find this and let's get it out. This is more of a nurturing, soothing, light massage, and just about anybody can receive it. And even if they can't necessarily receive a massage for whatever reason, you can still do light touch,
Well,
therapeutic holds.
the stress reduction is very important
It really is.
in any type of disease that you have. Is you are just stressed out,
Yeah,
and so
absolutely.
anything that can just help a little bit, in the long run makes a big difference.
Yeah. So, I mean, if someone has, I mean, really any illness,
Yeah,
like, don't think of them as their illness. Think of them as a person that just happens to have
they're
this.
just coping with that.
Yeah.
At the,
Like, they're just
at
a
that
person
time.
too.
Right.
And that person needs a love and compassionate touch.
Yeah, and that's very important to me. I think it's one of the important is to uh, let people know that you care
Yeah.
and give them that loving touch. But then we're going to go over a little bit later how you can't take that home or just drag you down.
Oh, God, yeah. I mean, you have to let it
There's
go.
a balance.
Yeah, you have to let it go after a while. So, I mean, yeah, I mean, just as long as you're not doing anything crazy with your client, then you should be okay. Now, there are a couple of things that you have to, kind of look out for, right? I mean, like, for example, some of the common concerns is that if they have cancer or if their cancer has metastasized to really any organ, then you definitely want to lighten up and don't overtax their body because their organs are already working on like overload anyway. So less time is usually better, and then absolutely less pressure, and then make sure that your intent for the massage is non-circulatory nurturing touch.
Do you still think they need a letter from the doctor saying it's okay?
Yeah, I really do, because and I was actually just going to get into that. There are a couple of like pretty common contraindications that come about when somebody has cancer or has received any form of cancer treatment or like surgeries, where their body gets put into a compromised position, and you need to know what to look out for. So one of the, I'm going to say, possible major medical conditions that someone can have because of their cancer treatment is something called deep vein thrombosis. And this is basically when the deeper veins of your legs, the walls become weak, and it's possible for blood clots to form in there. If the blood clots were to go into circulation through the blood, it could result in more than likely a pulmonary embolism, where it gets lodged in your lung, and then your lung collapses and you have to go to the hospital, and
Could be deadly.
hopefully it's not fatal. Yeah. Of course, it could also cause heart attack or even a stroke. And the crazy thing is that there's a lot of things that can cause deep vein thrombosis, or DVT. Any cancer, surgery within 12 weeks can do it, because you're laying on the table for that length of time. If you're over the age of 60, that can also, of course, if you have a family history, if you've been in a situation where you've been in bed rest, or you're just have like more of a sedentary lifestyle, and then of course recent heart attack and recent stroke within the last year can cause a DVT. So obviously with this case, you would not want to work on the legs if you know for a fact that somebody has DVT, or if you suspect that they have DVT, if they kind of like fall under any of these risk factors. And then of course there's also like, if let's say they do a biopsy on lymph nodes, sometimes that can cause something called lymphedema. And lymphedema is basically when the quadrant of that lymph node starts to swell with fluid.
Yeah.
And unfortunately, there's nothing that really can be done.
I wouldn't touch it.
Well, yeah. In that case, you would only do light holds. Like, let's say they have had a lymph node biopsy or surgery, or even if they've had radiation that has damaged a lymph node, that can cause it. But sometimes, like, it's kind of like a waiting game. You know what I mean? Like, they go through cancer, they go through, like, radiation that can, like, damage the lymph node, and then something at some point in their life can trigger it. And it can be like from the lightest touch to increase of circulation on the skin, and that makes it go into full-on lymphedema. So I mean, there's little things like that that you just may not be aware of when you're talking to somebody with cancer and who is undergoing or has undergone cancer treatment. So I highly recommend that you ask as many questions as you possibly can to your client themselves, and then definitely communicate with their healthcare provider. Of course, like, you need to make sure that you're doing so with HIPAA compliance, which means nothing electronic. It all has to be paper. It's a good idea to have like a form saying that the client will allow for you to release information from the doctor. And then it helps if you have something like a letter that goes to the doctor that is basically just saying, hey, this is what massage does, because some doctors still don't know what massage does. This is what massage does. This is what I would intend to do with oncology massage. Are there any cautions, considerations, contraindications that I should be aware of from this patient?
The good news is that I know the Atlanta School of Massage has been working with Emory University for quite a long time together to make this a more aware of how this massage can be part of the healing process.
Absolutely. We've been partnering with Emory for actually quite a few different research topics, but quite recently has been oncology for breast cancer patients.
No.
Yeah, and we're still kind of waiting to see what the results are on that one. But yeah, we're hoping to continue our research for oncology with massage so that we can, get more knowledge about it, so that it becomes more commonplace than,
It should just be an option.
Yeah.
It should be part of your whole health care.
Yeah. I mean, there's some places that you go where it definitely is an option. You can get massage, you can get acupuncture, you can get cupping, you can get, like all kinds of things.
Yeah, I think everything should be available, because I think your body reacts differently to different modalities.
Yeah.
Just like how an aspirin could heal me but kill you.
Yeah.
Our chemistry in our body reacts differently to different things.
Well, and I think that we are in a really awesome time where the medical community is actually looking at massage as something that actually works, and something that isn't hokey, or something that isn't sexual.
Yeah, it's finally being accepted by mainstream Western medicine.
Yeah, accepted and recognized as something that you can do. I mean, our doctor tells people to go get massages all the time.
Yeah, and that's changed in the last 10 years.
Yeah, absolutely. Well, it helps that, she knows massage therapists that actually know what they're talking about. Yeah. I guess, I mean, obviously, I can't answer specific questions here.
It's beyond your scope.
Well, it's not only beyond my scope, but, whatever situation you have coming up for you right now, I kind of need to know more information. And to be honest, you probably need to know more information as well.
Yeah, just like any other massage you're going to do, it's a case-by-case basis.
It really is.
So you can't say that this is going to be the same for every cancer patient like you could do for any client.
Yeah, absolutely. I mean, the frequency of your massages, the timing of your massages, like you may have to schedule in accordance to whatever, like radiation or chemotherapy treatment.
Yeah.
And sometimes there's going to be days where they're just not fit for a massage. And, it would be really nice if you just, honored what they were going through.
Yeah, and also that's why you need to be educated
Mm-hmm.
about this, because you can't massage some people that have gone through radiation, and you just you had that problem, haven't you, Sam, where you had massaged somebody who just had treatment
Yeah.
and you didn't even know they had it.
Yeah. Yeah. And had I known, I definitely wouldn't have been working on them in the way that I was working on them.
Exactly. That's
Yeah.
why you need communication and you need doctors'
Mm-hmm.
okays and
Yeah.
those type of things.
Yeah. I mean, blanket statement here. Make sure that you do a really thorough interview with your clients. I know, especially if you've been doing it for a while, it's all, humdrum, like, oh, it's just another client on my table. But you really need to respect the health of every single person that you see. Take the time to ask the important questions, and then make sure that you are doing the massage appropriately within your scope of practice.
And also, the clients have an obligation, if we've been seeing them for quite a while, is to update us sometimes. Because
Absolutely.
we don't, if I come to you and say, has anything changed? And you say no, and I'm halfway through the massage and you tell me you're pregnant,
Yeah.
that which has happened,
Or, well, my doctor just diagnosed me with cancer.
which
And, like,
has happened.
which has happened. Yeah. And it's like, I've been doing this massage on you for, like a good 45 minutes. You couldn't have told me before now.
Yeah, and so, it takes both of us to try to work at this, because
It does.
sometimes even when you ask the clients,
Mm-hmm.
they're mentally not
Yeah. Well, and
ready to
also,
tell you.
I think I said this before, like, you also have to consider that sometimes, like, especially with chemotherapy patients, their mind, like, is not all there, at least as far as memory is concerned. Like, they literally just may forget things that you would think that they would remember.
Mm-hmm.
Same thing with pregnancy.
Right.
Like, that tends to happen as well. But, do the best that you can, ask questions, and if I would say, go ahead, spend the money, do an oncology course. I wouldn't go crazy with an oncology certification, just because there isn't a whole lot of regulation with that.
That's going
But
to come, though.
oh yeah, eventually it will. So I mean, just get into a class, find out more.
Yeah, this is one of the things that you don't need to just go online.
Yeah,
It's something that needs to be more in depth.
yeah.
It's something, that you need to have a lot more information
Mm-hmm.
than you would other things.
Yeah, go to somebody who has done research, a lot of research, a lot of, anatomy and that kind of stuff. Go to somebody who knows their stuff.
The thing about this, Sam, I didn't even think about this when we started this, but this is an excellent segue into overload on empathy.
It really is.
I mean, because we're talking about cancer,
Yeah.
and, we both have parents who
Mm-hmm.
have had cancer. Mine passed away,
Yeah.
and so it's something that's very close to us.
Yeah.
It's
It
personal.
really is. Yeah.
And so,
And your topic is empathy overload.
yeah, empathy overload.
And that happens quite a lot for the family members and the
Oh,
caregivers
yeah.
of cancer patients. It also happens quite a lot with massage therapists.
Yeah, this happens with all the
Really,
caretaker field.
yeah, I was gonna say really anybody in the caregiving.
Yeah, and that can be
like
in
industry.
relationships too.
Absolutely,
And
absolutely.
so, everybody's a caregiver occasionally.
Yeah. Well, take it away, Alan.
Well, the thing that I was going to go over initially is talking about empathy overload. I'm going to tell you a quick story of a massage I did when I was in school. And I was not aware of empathy overload or how massage actually affects you personally. I was thinking that it was just basically, I can handle this. It's not going to bother me type of person, because I started in massage school as an older student. And so I thought I had gone through a lot of things and said I can cope with things, you know. And so the school had a volunteer work at a hospice,
Mm-hmm.
and I signed up for it. I went down and did a massage, and the first lady that I did, and I've hadn't been in any type of massage before because I was a student, had AIDS. She was a 20-year-old lady, two kids with AIDS.
That's sad.
And at that moment, I knew that there was nothing I could do to make her fully better.
Oh, God, no.
And so, a lot of times, you have to do is what can I do to help suffering just for a moment?
Yeah.
You know, you put a loving touch on somebody for a moment
Mm-hmm.
can give them a momentary pleasure or a momentary mind where it feels better.
Absolutely.
Anything that reduces a little bit of suffering is going to be something that I did not expect. I was thinking massage. I'm going to be working on people, but sometimes this can be serious stuff.
Oh, yeah.
I mean, and I was mentally not prepared to go in and give somebody a massage that I knew that might not be alive in a week, and where it was in tremendous pain and being uncomfortable,
Mm-hmm.
and being able to touch that person, Sam,
Yeah.
and see and feel just a relief or somebody, just for that moment
Mm-hmm.
that felt a little bit better. And it was overwhelming.
Absolutely.
And it was overwhelming for me because, I wasn't prepared mentally to for all that empathy that was going to come my way. And so after the massage, I got back into my car and literally sat in my car for 30 minutes before I could even crank the car. I did not have enough energy to even lift my arms up.
Yeah.
And it was a weird, strange feeling.
Mm-hmm.
I had never been zapped that much energy or that much emotion or that much empathy at one time where you were just about I was unable to function as a human.
Yeah.
I was able to felt like I could not drive.
And the thing is that like it doesn't need to be that kind of an extreme scenario
No.
to recreate that.
No.
You have a couple of clients in the day, and all three of them or four of them, they are needing empathy just like anyone else. And sometimes it can just completely zap you, like take away your energy, take away like really just the feeling of being a person.
Yeah, so I learned very quickly that I needed to do something to help myself, to be aware of that transference, because I was not aware, I wasn't ready for it.
Yeah.
And so I've done things now like meditation, qigong, those things that helped me personally. Everybody's got to find their own path that way.
But I definitely recommend that you
find it.
Something. I mean, I tell my students all the time, like, find a therapist to talk to.
Exactly.
Find someone that you can talk to that can understand what we do, but is not another massage therapist. Because sometimes two massage therapists can get together, and you and I know this, and it basically becomes a bitch fest.
Yeah, it's just complaining.
Yeah, and complaining does not actually get to the heart of it. You need someone to like really take you through the thought process of, okay, so what does this really mean to me, and what does that do when this happens? How does that make me feel? What does that mean to me, like internally? What route does my brain go down when that happens? And how can I understand it and be aware of it so that when it happens again, it either doesn't affect me as much, or it still affects me, but now I'm aware of it and can understand where it's coming from.
That's very key, Sam, is to be aware.
Mm-hmm.
A lot of times, once you're aware that you are feeling that way, there's been many times we've come home and I said, yeah, now's not the time to talk to me.
Yeah, exactly.
And we understand that.
Mm-hmm.
We know that sometimes we need to process all the junk that we have gone through that day.
Yeah.
And it's not anything that our partner can help us with.
Mm-hmm.
I mean, we've got to understand what's going on ourselves.
Yeah, I kind of feel bad for Alan sometimes because I'm an introverted person anyway, and then I go to school and I feel like I have to be like on stage. I'm on. I love my students, but sometimes they are just need machines, and it takes all. It literally takes my all sometimes, and by the time I get home, I just can't. I can't give anything else to anyone or anything else.
Yeah. Or, basically you're just going to sit on the couch and that's it.
And then poor Alan, like, tries to crack a joke and
forget it.
And I give him like death stare.
Oh no. Yeah, I said, this is not the night.
This is not the night for this kind of joke. Sorry,
Even
baby.
though, but I still say it.
Oh, yeah, he does.
It doesn't stop the thing, but I just know that I'm not going to get the result that I normally get.
And I have just learned just to not talk, not talk to him in that moment.
Or sometimes she'll say, middle of my sentence, good night.
Yeah, good night, and go to bed.
I just talk. What?
Nope. Good night.
Nope. I can't handle this. Good night.
Good night.
Can I come to bed? No.
No. You need to stay out here for a little bit longer. But you know what? Like, if you and I were not aware of this happening, I can see how, like, this would probably break up some people and get people into fights.
Exactly. We know that, that's the great thing about us being in the service industry, both of us, is that we have an understanding that it's going to happen to everybody.
Yeah.
That you're going to be introverted once you come home sometimes that just don't want to be bothered by anybody, by anything.
Oh my goodness. And on your days off, it's like you can't like pay me to leave the house sometimes.
Oh yeah.
Yeah. It's like, sweetie, you want to go to a restaurant? Nope. Sure don't. We're having frozen pizza here.
That's right. Another thing you get to the point where you don't want to, on your day off, you do not want to do one massage.
Oh God, no.
Because it just takes one to get you back into that place.
Yes.
And so that's one thing I wanted to make sure that everybody
and
that starts massage therapy like I did, be aware of the mental drain and empathy drain you're going to get from your people because they're needy.
Yeah.
They're coming to you because they're hurting or there's an emotional thing happening. That's the reason why they're coming to us. And so they do expect us to have a sympathetic ear and a loving touch.
But you need to be aware enough to also set boundaries.
Oh, yeah.
Make sure that you're taking those days off. Yeah. A friend comes over and wants a massage. Yeah, that's awesome. But no, that's not awesome for you. You need to have a day off.
Decide when it's best for you and stick to it because it's so easy to say, well, it's just one massage and I like that person.
Yeah.
They're a friend. But if you keep doing it, you don't ever have a day off.
Yeah.
You're always on, and everybody needs time off.
Absolutely.
But the thing about empathy is something that you need. I mean, it's not something that you're avoiding or something you should stuff down. No. And in fact, if you go in there and if you're a massage therapy and don't have empathy, I think that's going to be you're not going to succeed in massage therapy.
I mean, honestly, if you don't have any empathy whatsoever, that's pretty much a sociopath.
Yeah, that you're not going to succeed in relationships, massage therapy, or anything else.
Really, anything.
No.
There's a level of empathy that you need just for normal communication with others, but when it gets to the point where it drains you then that's when you need to back off.
Yeah, when you know that once you get through with your work and you cannot communicate with anybody else in your life, and you need to, like family, kids, and it makes it so hard for you to just function as a human being, yes, you need to realize that it's happening and look at ways to release some of that, or avoid it altogether, or we're going to have another topic about this, another
Yeah,
podcast.
because like at some point we're going to talk about boundaries.
Yeah.
Specifically, and then I have another thing that I'm working on where we're talking about empathy in regards to energy work.
Yeah.
Because it's basically the same thing.
Yeah.
It's just a little bit different.
Yeah.
Yeah. And massage therapists have a tendency to like really dive into their empathy and then come out with some pretty amazing gifts in the process.
Yeah, it's a great gift, empathy, but it can be to the point where if it's overloaded, you need to back off, because you won't be able to love the people you need to that are around you. I mean, you can't come home and love when you're tapped out of everything.
That is true. So, yeah, Alan, that was a really good show. It was a really good combination of topics.
Yeah, you
And
know
we
what?
didn't
We threw
even
those
plan
together
that.
and we didn't mean to, did we?
No, we really didn't.
But it sure fits, that's for sure.
It does. Well, thank you guys so much for joining us today. I hope that this was a good episode for you guys and that you learned a little bit. I know I feel really good about getting that information out to everybody.
Yeah, that's something that I wanted people to know, that cancer is something that can be helped with massage, not cured, but helped, a part of the process. And it's also important to know that your emotions are also tied into massage, and empathy is something that can be very, very draining.
Absolutely. Well, let's see. Now, of course, you can find us on Facebook.
What?
Ask a Massage Couple.
Okay.
And we've been posting our episodes on there. I've also started posting our episodes on Twitter.
Yeah.
A massage therapist.
Okay.
At a massage therapist. The ask was just too many letters. I've been kind of fooling around with Instagram a little bit, but not really.
Okay.
Yeah. And of course, you can always find us on iTunes or Stitcher.
Okay. So Facebook. Do we have an email, right?
Oh,
Remember,
yeah.
we talked about emails.
Yes, of course. Yeah, you can always email us if you have any questions.
Don't email me.
Don't email Alan. Email us at askamassagecouple@gmail.com.
Well, Sam, I've enjoyed this afternoon.
Yeah, me too.
Love and compassion.
Love and compassion, y'all.